A lot of us in the medical field, we crave that validation. It's probably has roots in trauma, again, from medical school and residency, because it is very much so based on who's doing well, who's not doing well, who's able to answer this question on round, who's able to present the best thoughts, who's able to compete well. And so if everything's a competition, then it can always feel, if you're not number one, that you're not doing what you should be doing. And that's a perfectionist mindset that ultimately leads to imposter syndrome that I would say it ultimately will be helpful to get rid of and continue to believe in the value of your experiences and of the information and knowledge that you're sharing.
To the Recalibrated Vision podcast, where we are having conversations with healthcare visionaries who are transforming from career to calling. I am your host, Bianca Ariel, founder at Recalibrated Vision, a global strategic advisory and media production company helping physicians and healthcare visionaries build the future of whole person care. Today, I'm joined by an incredible physician, an educator, a speaker, and a healthcare visionary, Dr. Zola Quao. Dr. Quao is a dual board certified Yale-trained physician whose work sits at the intersection of allopathic medicine, lifestyle-focused medicine, integrative therapies, psychiatry, family medicine, and social justice. She has built a career around caring for people across the lifespan and mental health spectrum, with a particular passion for underserved and marginalized communities. But what I really want to explore today isn't just what Dr. Zola does. I want to talk about why she chose to do it. What happens when a physician realizes that the traditional career path doesn't follow or fully encompass the vision they have for their impact? And what does it look like to move forward toward integrative psychiatry, build an independent practice, step into speaking, and ultimately use your voice and your story to create greater awareness and change? Dr. Quao is also a client of Recalibrated Vision, so I am actually especially excited to share her journey. Dr. Quao, welcome to the podcast. How are you feeling today?
I'm feeling great. Thanks so much for having me today, Bianca.
Oh, I'm excited. All right, so let's hop into it. Yale-trained. You're a dual board certified and Yale-trained with experience spanning psychiatry, family medicine, research, teaching, public speaking, and I see here medico-legal work. So you're doing it all, okay? So take us back to the beginning. Like, what inspired you to get into medicine? What drew you into medicine in the first place?
Well, actually, medicine first repulsed me. If I'm being quite honest, both my parents are physicians, and they're they worked a lot when I was younger, and so they were always at the office, always waking up early or being woken up in the middle of the night, getting pages on their beepers, and it just seems like, oh my gosh, they have to do all.
What kind of
Again?
what kind of physicians were they?
My mom was a family physician, and my dad was an internist.
Okay, go ahead.
Yeah, so internal medicine. He basically he only saw adults and no pregnant people or children.
Got
And
it.
my mom just saw cradle to grave. Yeah.
Nice. Okay.
So yeah, they both really worked very hard, and so I had that model of hard work when I was from a young age. But it seemed like too much work to me from my standpoint, especially since I was spending a lot of time with my grandma or my cousins who were also living with us, and they were usually our childcare because they were like 10, 15 years older than us. But as I got older and I started to mature and I saw the impact that my parents had on people's lives, when I was, going through high school, taking those aptitude tests and trying to figure out what was a good synthesis of all the skills and um, gifts that I had. And so I started college pre-med. I wasn't quite sure about it, but I wanted to keep that option open because I knew that it was a job that I could make a difference. It was a job that I could create a path for myself. I didn't know very much, but I did know what I, did know is that I liked having, some version of control over what my work was, and I wanted it to mean something. I wanted it to be meaningful. I didn't want, to have a job that didn't feel like it wasn't, that felt like it wasn't making an impact on the world
Mhm.
at large, and specifically in a positive sense. So I started out pre-med, but I ended up majoring in French language and literature
Oh.
because I had a wonderful advisor. Really all throughout college and medical school, because my this advisor was at this medical school training and for college at Yale, medical school at Yale, and then he went on to do his neurosurgery residency. Is now practicing in Miami, but he told me at our first meeting, there's only three numbers that they look at. They look at your MCAT score, your math science GPA, and your overall GPA. After that, that's the only numbers that they care about. And then you have to show that you're an interesting person, that you're passionate about something, that you have interests, that you can carry a conversation with people. Because those so-called soft skills are actually incredibly important
Mhm.
when it comes down to discussing really personal and potentially life-altering topics.
Mhm.
And so I went through, I think, probably shielded from a lot of the med school stress. I got a C in my my second semester of physics class, and I was thanking the Lord that I had passed it all.
Mhm.
And many of my friends, they got a B or a C in a class and just left pre med altogether. So
Oh.
I, uh, got through all of my training, and it really was seeming like it was an actually good fit for me and all of the extracurriculars that I'd done, and going through medical school, being able to find my calling in family medicine and psychiatry, and being able to integrate the two in my day-to-day practice and business is, uh, there no day is dull. I'm never really truly working. I'm always serving,
Mhm.
and I'm happy that this is what I get to call my path.
I don't think I've ever asked you this. Are your parents from the States?
No, no,
Okay.
my mom's in Zimbabwe, and my dad's from Ghana.
Okay. Okay. Zimbabwe and Ghana. So they came to the US when?
So my mom came, I believe it was 1976, and my dad came in 1967.
Okay. Because I have a lot of clients and I talk to a lot of other physicians, especially Black physicians, and they always talk to me about being the child of immigrants and how they were heavily influenced to go into either medicine or becoming a lawyer. Did you feel any pressure or any influence to actually pursue medicine in your household?
It's kind of yes, kind of no. I think my dad was generally like, are you sure? There wasn't a lot of like, oh yeah, definitely do this.
Okay.
Of course my mom was my mom was would be super happy for me to be a physician. And so uh it, but it was just an enthusiasm on her part if that was something that I was interested in. But I didn't necessarily feel forced. I was more so forcing my parents to allow me to do all these extracurricular activities that I just liked for myself. It wasn't necessarily that I was out to build my resume, but I wanted to take dance classes. I wanted to be part of the school play, and I wanted to play volleyball and basketball, and I wanted to do, student government and, quiz bowl, all these things that, ultimately required somebody to pick me up and drop me off because I couldn't drive for, a good portion of high school. And so they were supportive, and definitely I know that they would be quite happy, and so I was like, "Oh, man, I'm gonna please my parents.
Uh-huh.
I'm just gonna do exactly what they would want me to do," but, it is also what I want to do, so
Yeah, of course. You
well,
said that originally medicine repulsed you. So did you have like another career path that you wanted when you were a little girl?
mm, all of my career paths when I was younger were, it ranged from, wanting to be an ice cream truck driver and an ice cream business so I could eat as much ice cream as I wanted, or, being like a child star, like in the Disney Mouse, kind of like the mouse pack, whatever they, called it, at
Mhm.
that time. And, um, In college, it was, uh, yeah, I think the only other thing that I really enjoyed was travel and acting and arts
Mhm.
and finding some way to, be a dancer, professional dancer, artist, or travel professionally. I majored in French, French literature and language, and so a small part of me was like, oh, maybe I'll just move to France and figure it out from there. Uh,
Yeah.
but uh,
Do you speak French fluidly?
fluently enough, I was just in France in June, and I'm able to communicate well enough to get through travel delays at the airport, and
Okay.
so there's stressful situations, we can get together. Is the grammar all correct? No, but the people understand the content and the main, purpose of what I'm saying.
I love that. That's great. So, yeah, it sounds like if you do your human design, you might be a manifesting generator. So, just having all of these different interests, and I love that you were able to kind of really explore all those different things and not kind of box yourself into one specific, realm and really explore all the different parts of you. And so, we know that you've had extensive experience in the conventional medicine space and still are, right? Doing various things, but then you've kind of moved toward more of an integrative approach. So, was there a specific moment in your career that made you think, like I want to start practicing medicine from a whole person care perspective?
I there's a longer term sort of just concept of self that I've developed that has that's developed over time, seeing what I've gravitated to and seeing what I like doing. And I've always been somebody that isn't just in one sphere or mold. I wasn't just an athlete or just a science kid or just a theater kid. I did all of those things, and I didn't have one group of friends. I was, bouncing around everybody, and
Mhm.
it was where I felt most comfortable. I wasn't um, pigeonholed or put into one box. And so I had this idea about myself that this ability to stay fairly diverse in my experiences would be something that I would want to continue in my work and professional life.
Mhm.
And when I was in medical school, I was between family medicine, obstetrics and gynecology, and pediatrics.
Mhm.
And I with all of that training, because I ultimately got training in all 3 of those things, had it on psychiatry, which was not something that I was expecting to love so much, until I did my rotation in medical school. But I don't know, I guess I've always been, a little bit somewhat crunchy. My with family from Zimbabwe and Ghana, my concept of medicine at a baseline as a child was broader. I come from a family that saw herbalists and witch doctors, and being able to understand that medicine is actually a very broad. You can think of it very broadly and concept wise, and thinking about not just, pharmaceutical pills, but food that can be medicine to people, and community support that can be medicine to people.
Mhm.
Um, and just take time, giving someone time to just let something out is medicine to people. And so as anyone might notice, the allopathic medical field where I got my medical training, it is great, but it doesn't completely encompass the breadth of problems that we have. And also, there's a lot of reasons why people might not want to opt for pharmaceutical remedies or surgical or outpatient procedures, and still wanting to help people, even if they had those aversions or if those things just hadn't worked for them. And
Mhm.
even for myself, I've been a patient as well, and I've seen, oh wow, this is, the medical field doesn't necessarily always have on offer what I'm looking for. And I don't want to just opt for a surgery in this case. I want to see how this can be managed, medically rather than procedurally. So I've always wanted to help people. I've always wanted to meet people where they're at and not wanting to turn people away from care because of silly little things like ability to pay or um I'm always wanting to find something that we can do for somebody, even if we're late. We've already, you know, late to the cancer diagnosis, things are not going well. But there's still a role for medicine and psychiatry in those moments. Even in the death process, you can always do things to help make things a little bit better. And so I found that the best care that I could give was care that extended outside of the allopathic medical training. And I self studied learning about nutrition medicine, herbal medicine, lifestyle medicine, and found that it really offered me the truest expression of the medicine that I wanted to do. Because I didn't want to be somebody who was meeting with somebody who was having late stage complications from their chronic diabetes and start having those nutrition conversations at that point. Start having conversations about even what diabetes is to them at that point. Because a lot of patients are just told that, oh, you've got high blood sugar, but they aren't really told why and how, mechanistically that might cause problems in their organs. And I like taking time with patients. I like making sure that people understand the reasoning for what we're doing and what is potentially supposed to be happening in their body and how they're supposed to be feeling and functioning better.
Mhm.
And that integration of medicines just fell in line with that integration of all of the skills that I got from government, dance, uh, theater, uh, quiz bowl, science bowl, all these things that I was
Mhm.
doing as a child and not uh, niching down, not specializing.
It makes sense that you're taking more of an integrative approach because it seems like you've been exposed to all of these different avenues from very young. Even having parents from a different country who are, comfortable with things like herbal, herbs and things of that nature, that feels very natural to them. So you were exposed to the concept of integration from a very young age. So this kind of feels more natural for your path. Whereas, some physicians, they were only exposed to the conventional way. And there was specifically like a catalyst, like in their practice where they realized like, okay, I want to start serving in a different way. And then they started to kind of embrace a different path and kind of go through that experience. It seems like that was already embedded in you. So when we talk about looking at the whole person, right? How does this change the way you understand and treat when it comes to mental health?
And so when I think about the whole person with every patient that I see, I always do an assessment, a global assessment of their medical symptoms, if any, history, psychiatric history, and also their experience with the medical field, both on the medicine side and the psychiatry side, because I want to get a sense of what was the breakdown in communication, if any, there. What was the issue with rapport building or trust building between patient and provider? Because I am always there with trying my best, coming in peace, and doing my best to do no harm. And when there's already a preconceived notion about, ooh, this is a doctor, ooh, this is a psychiatrist, people have this immediate idea that I'm going to rush through their care. I will only offer them a certain number of things. I won't want to talk about nutrition. I won't want to talk about exercise. I won't want to talk about the context uh, economically and socially that we are all in as a society, that I won't want to talk about any of those things. But those things are impactful for our mental health. And if we're not talking about those things, then it's just a huge portion of the care that's not being accounted for. And
Mhm.
so it's an incomplete assessment as far as I'm concerned.
Mm.
And being able to integrate all of those things and help people put their thoughts and emotions and feelings about what's wrong with me into a context where we can say, hey, there's nothing quote unquote wrong with you. There are maybe some deficiencies or areas where there could be growth, but there's also a context in which you have a lot of stressors in your life, or there are a lot of things out of your control that are impacting you and making you personally feel like there's something you're doing wrong that's causing this to you. And
Mm.
that's not necessarily the case. What we can't do, however, is manage the things that we can control and be as best of a caregiver and caretaker of this one body vehicle that we've been given in this mortal realm on planet Earth.
Mm, mm. Now, you also bring a strong commitment to social justice and human rights in your clinical work, research, public health communication, and education. What do you believe our current healthcare system is missing when it comes to mental health access and whole person care?
I think that there's a lot of pathologizing of
Explain what you mean by that.
uh, uh, so people will say, "Oh, this person is having trouble sleeping. Wow, they must be bipolar."
Mm,
Or, "Oh, let's throw the medication. Let's do something." And everybody's looking for a pill, a supplement, something to take away this issue. And the slower approach might include an assessment of health, an assessment of diet, assessment of activity, an assessment of social interaction. But medicine isn't incentivized to be slow or methodical or to emphasize anything that you can't directly bill off of, because you can't make money off of prescription for ginger tea.
mhm,
It's not a money making process. And so with that emphasis on making money, there isn't really a lot of space for the things that help and support our health, but don't necessarily make money. And it, it is the nature of the beast being in a capitalist system. And yet, we don't also need to incentivize illness in the way that it comes out in our day to day medical practice.
mhm.
Um, so, yeah, it'd be nice to just give people more time for their visits so that we're not cramming in 20 patients a day so that we can meet our mandatory minimum quota. But instead, really giving care for people that feels like they're being understood and heard rather than given the standard of care,
Mhm.
which might really truly be substandard in comparison to some nations.
Yeah, and I love that you mentioned like the ginger tea is not going to be as, lucrative as, another alternative. And that's something that we talk about when it comes to under marginalized communities is like the access. Like we talk about, okay, we want to provide more whole person care and, more integrative approaches, but obviously access is an issue. So of course you have being able to find a physician that focuses on the mind, body, and soul, but also the remedies that come with your experience with the physician. And like you said before, like a ginger tea, is not necessarily, going to be as lucrative to the organization, but that's accessible to the common human being. So I feel like through education and letting them know that is available to them will kind of ease their mind around how they'll be able to not only afford access to seeing a whole person care physician, but also the solutions that the physicians are going to give them as well.
And it really is supporting the person, the patient, the client taking a more active role in their healthcare, because healthcare isn't a singular endeavor. It really is a team effort.
Mhm.
And the patient is the leader of that team.
Mhm.
They're the one that ultimately will have to start integrating more leafy greens into their diet. They're the ones that are waking up in the morning, getting sunlight, first they're early in the morning,
Mhm.
getting some movement in early in the morning, maybe looking up the morning qigong movements. And all of my work is recommendations and support. Everything else the patient is actually doing for themselves with support, but they have guidance and they're not just out in, lost in the sauce and not sure that what they're doing is actually leading to the outcomes that they want.
Right, right. Absolutely. So you didn't just develop a different clinical philosophy, you decided to build an independent practice around it. So tell us about Harmony Family Psychiatry. What was the vision behind creating your own practice in the first place?
I wanted to create a practice that ultimately didn't have someone saying, "Hey, we've got to keep these visits to, 15 to 30 minutes because we want to make more money." And I get it. I really get it. I love making more money. I do. I would love to make more. I don't think I'm alone in that. But I also have a standard of care and practice that I really wouldn't have been able to fully operationalize unless I had my own practice where I set the rules, I set my schedule, and set the policies around how we're going to handle certain things. I think that there's a lot of practices that exclude people who use substances. There's a lot of practices that exclude ADHD assessment. There's a lot of practices that exclude all controlled substances, full stop. And there's plenty of practices that don't even want to talk about supplements as an alternative
Mhm.
to pharmaceutical medications when they are legitimately viable alternatives and may actually be a better fit for somebody's lifestyle.
So let's talk
So
about that. Why would an organization not want to first accept patients that are on controlled substances? Because I can imagine with psychiatry, most of the time they are on a controlled substance and they do need
it's
support and guidance, right?
yeah, it's a multi-pronged thing. I think the controlled substances, they have a because they're more controlled, they have a higher, administrative burden from times, having to send in a prior authorization saying begging the insurance company basically to cover the medication for the patient, and so potentially wanting to avoid having that administrative burden on responding back to prior authorizations. The patients that might be on controlled substances might have higher needs
Mm,
and or be more complex, especially since those medications are high risk medications, and and the practice might want to keep the patient population more mild to moderate complexity,
mm,
and it's easier to do those quick visits
mhm,
because the complexity isn't necessarily there. There isn't chronic pain on top of chronic panic disorder and agoraphobia.
mm,
And because these people do need a lot of support, and if the practice really does not have the support like that, then it's in the best interest of everybody involved that they find a practice that has some of that infrastructure and has a plan for people who might need a little bit more support and might have more complex needs.
makes sense.
And then ultimately there is the abuse potential and people can get really attached to the medicine more so than to the process of healing. And so the pill itself can become, this is my thing, this is the only thing that helps
Mm,
me. And the creativity around problem solving their ultimate root problem kind of dies out. And so it doesn't ultimately help their healing and growth and progress because I've got my magic blueberry
mm,
and against the world and you can't take this magic
right.
blueberry away from me. But the magic really truly is within all the medicines that I prescribe or that I offer, supplements, herbal herbs. They're mimicking what the body is already doing for itself.
Mhm,
I already have a pharmacy within our bodies that is running 24/7. It's just knowing how to work with that and how to manage it in such a way that we're keeping our life systems in balance. We're keeping our general perception of ourselves and our lives in line with our, what feels good for us. It
Right.
feels ego syntonic rather than ego dystonic, something that feels like it's not a part of me or it's not aligned with me.
Yeah. So it sounds like it just depends on what the goals of the organization is, right? Are they more dependent on time? Are they looking at financial, maybe administrative burden, maybe all three, just to really assess what kind of patients that they want to take in. And based on that experience, you realize like there is a market gap here, and there are patients that essentially could fall under any three of these categories. And you wanted to create a space where you can dedicate more time to really learning more about them from a whole person care perspective, so that you can kind of bring in all of the different modalities to really serve them in a very unique way. Now, you're also stepping more intentionally into speaking. So, talk to me about what calls you into the speaking realm, and why do you believe your voice needs to be a part of the work that you're currently doing?
And no, and you bringing this up, I'm realizing that while I might not have said this explicitly to myself that I want to be a teacher, but I've always really admired teachers. They have been the people that have gotten me through my biggest role models throughout my childhood, outside of my parents, have been teachers that have made an impact on me and that have expanded my imagination, my creative skills to empower me to believe that there's more that I can do in this world. Or, wow, thank you for that insight. I've completely reframed how I thought about this problem because of the blessing of this person's voice and them sharing their knowledge.
Mhm.
So I like that medicine is lifelong learning. There's always something for me to learn. And I spend a lot of time doing health education, nutrition education, sleep education, psychoeducation in my appointments that I realized, wow, I'm more of a teacher than I ever thought that I would be.
Mhm.
And that's exciting. I've always wanted, a teacher to be the president of the United States. I feel like a teacher would be a person who really would understand the needs of the whole and be able to transmit information in a way that people could understand. And I suppose I'm just following in that inspiration, wanting to now step into the shoes as a teacher, as those have stepped in those shoes before me and have improved and changed my life, and wanting to pay that forward.
Mm. Yes, beautiful. Now, as we talked about earlier, you have the expertise that extends far beyond the exam room, right? So you have expertise in medicine and psychiatry and human rights and social justice and mental health and integrative psychiatry and all of those things. And along with all of your lived experience, how are you thinking about bringing in all of the different parts of you into your speaking platform and ultimately your story?
It's actually an opportunity to express my fullest self. I get to bring the personality that is serious, but also understands that we have this one life. I would like to spend as much time happy
Mm.
while I'm living it. And I I spend so much time taking things seriously. I would like to have some space for levity in my life, paired with some of the most depressing things that one could end up talking about in
Mhm.
a day. So it gets at this lifelong preference towards diversity of experience, towards integration of experience, towards being in multiple different types of rooms with multiple different types of people from multiple different types of socioeconomic cultural backgrounds, and still finding benefit from that space, from that exchange of ideas, of energy, of passion.
Mhm.
And I love the idea of being able to show people that medicine and physicians are not necessarily what you envision them to be. And there are many that may not be the best choice for you and your care to be part of your healthcare team. But there are so many of us who are, even for ourselves, choosing differently for our own health and still integrating the two. I don't want to demonize any side of the health and wellness space. But I do want there to be discretion. I do want there to be safety. I do want there to be freedom of choice, like no coercion, no one telling you, you must follow this plan or you buy my specific supplement. I don't believe that is an ethical way to be a healer.
Mm-hmm.
Um, but I do want to be a healer, and healing is something that can
You
come.
are a healer. Yeah, you are a healer.
Right, right. I am a healer. There's so many different ways that one can take part in that practice of healing and speaking truth to power. Thought leadership. That is just one way to offer people medicinal thoughts.
Mm-hmm.
It's the ideas are like viruses. They can spread like wildfire, like an illness, and being responsible for sharing good medicinal thoughts out into the world is, again, just another blessing that I would love to be able to share.
Yeah, I just love how like voices are expanding beyond exam rooms. And so this is a little off topic, but kind of on topic. So I was working with a client right before this, and one of the things we were going through were like the titles that were had like the best hooks for her content, and she's also a physician. And one of them, she's a functional medicine physician. So one of the hooks that kept coming up in the system that was great was, blah, 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 what your doctor doesn't tell you, or what your doctor won't share with you, or your doctor, what your doctor's not going to explain to you. And that's something else we were talking about is like, there's so much social media out there where people are getting all their information about how to really heal themselves from all of these different entities. And it's kind of like conventional medicine has this stigma, but through the work that I'm doing, I'm working with so many physicians who are really finding their voice, and they've always had this foundation. They've always had this idea on how they wanted to treat people to begin with. They've always identified as themselves as healers. That's the reason why they got into medicine, to help people, right? And then unfortunately just had to work under whatever function or whatever organization, they were brought into. And so to see that, trained professionals that are dealing with all different types of people are starting to really activate their voice and really give us the education that, they have, from a professional standpoint, and bring it out into the marketplace. I think it's so beneficial for us as a community, but also it's so beneficial for themselves. Like, I feel like they get to actually really step in to who they already always felt that they wanted to be. And so speaking
Right.
is definitely one, and educating is one of the ways that they can really exercise, the voice that they were, felt so limited or didn't have the time to have or express, working in certain structures. So I just love that we're starting to get education, from people who essentially dedicated their lives to doing this from the very beginning. So I could imagine that feels really fulfilling to really tap into.
Oh yeah, yeah. And when you've really seen how the sausage is made, you start to have some feedback about how it could be made a little bit better.
Mm-hmm.
Because it's not just patients who suffer at the end of these things, it's everybody that's working in that organization, from the nurses and PAs to the administrators, and everybody is stressing. And it doesn't necessarily need to be so hard. And we can still have outcomes that people feel good about. They can feel that they have their autonomy, that they haven't been overlooked or mislabeled.
Mm-hmm.
And even if the care doesn't go the way that they would want it to,
Mm-hmm.
it's not due to anybody not listening or not trying their best.
Mm-hmm.
Sometimes a difficult and complex situation is just that, very difficult and very complex.
Mhm.
It, it is a challenge, and there's nothing that anybody can do to make it less difficult or less complex.
Mhm.
But we can set forward with a can do attitude and attention to what can be impacted, what can be fixed. And I think that ultimately everybody feels better leaving that appointment, feels better leaving that case when there has been that more bidirectional exchange that is open and not quite so pressurized.
Mhm. Mhm. Now, before we go into the next segment, I want to ask your opinion from a mental health perspective. I work with a lot of physicians that struggle with imposter syndrome. And so when they're thinking about really using their voice and educating the public on their expertise, a lot of them feel like, they're not prepared, or they have to have a certain um, structure, or they have to be in a certain position or be a part of some board or have 5 more years of, it could be anything. So talk to me about imposter syndrome, and when somebody wants to, or maybe one of your colleagues wants to use their voice, and really start educating the public on their area of expertise, but is struggling with that imposter syndrome. What is the advice that you would give them?
Mm. The advice that I give them, uh, I would say uh, I, uh, I don't fault you for feeling that way. There is a lot in medical training that is geared at making you feel as if you don't know anything, you don't have power, and that the only people that do know anything or do have power have clawed to get it over 34 years, and they've won all these awards, and they've rubbed elbow with all of these important people, and you'll never measure up to this professor emeritus until you have reached some nebulous uh, form of leadership in this space and have won the approval of the top dogs of your hospital system or of your clinic. That said, that's all a lie that has been shipped to us from the vaulted halls of academia, because medicine at its base was one that was very hierarchical, that by definition was meant to be very hard on the trainees. Residents actually lived at the hospital. They stayed there and managed everything, but the big bosses, we would eventually hopefully get up to being, they were able to go home and stay at their own houses. Believing that there's nothing that we can offer, however, is probably the biggest myth and deception of all, because we're learning all of our lives, still learning, even after 15, close to 20 years of education and training after high school. Uh, and after that 15, 20 years of education after high school, there's still so much to learn. And if us in our postdoctoral training degrees are still learning every single day, then that means that there is education and information that we are receiving that could potentially stop with us unless we share it.
Mm.
And the value of sharing that information, sharing that knowledge, sharing that learning is empowering people with knowledge and insight so that they can continue to be better caretakers of themselves. It can feel really invalidating, and there can not always be a clear, um, what's the word I'm looking for? Clear, um, positive feedback uh, that you get. This, yeah, I'm blanking on the word, but there's not always this, good job. You did a great job. Here's
Validation.
this validation. Yes, there's not always that validation that comes with the work that we do, and we're so dependent on it. A lot of us in
Mm.
the medical field, we crave that validation it's probably has roots in trauma, again, from medical school and residency, because it is very much so based on who's doing well, who's not doing well, who's able to answer this question on round, who's able to present the best odds, who's able to compete well. And so if everything's a competition, then it can always feel, if you're not number one, that you're not doing what you should be doing. And that's a perfectionist mindset that ultimately leads to imposter syndrome that I would say it ultimately will be helpful to get rid of and continue to believe in the value of your experiences and of the information and knowledge that you're sharing.
That was so powerful. Like that was so powerful because I understand it from an outside perspective. I understand it from a high performing perspective, but I'll never understand it from a physician's perspective, right? I don't have that lived experience. And so, the way that you explained it, I really felt it because I totally understand the correlation. And ultimately, what holds some of my clients back is this perfectionism. But this is something that has been ingrained and conditioned, through school and beyond. And I think that another interesting piece is when you talked about that validation, that reinforcement, constantly when being a physician, right? And that's something that you don't get instantly when you embark on any new path, right? Whether it's starting a business or becoming a speaker, starting your podcast, going on social media, you're looking for those external metrics that you've always measured yourself on, through the entirety of your career. And so now you don't have that right away. You don't have that instant gratification. You don't have somebody that's going to come and tell you you're doing a good job or you got an A. These are things that you have to build up, and it's a completely new skill set and a completely new mindset. And so thank you for sharing that because that also helps me understand the clients that I'm working with better, to really kind of be able to kind of meet them where they're at, so that they can, so that I can understand this experience while also supporting them and really kind of moving past this experience to fully step into what it is that they feel called to do. So thank you so much for sharing that. That was really impactful.
I'm still unlearning it. I can't say that I'm a fully reformed perfectionist, and I find myself second guessing myself plenty.
Mm-hmm.
But my internal monologue is one that is more validating and encouraging rather than continuing to self silence.
Yeah, and just when you kind of touched on the internal dialogue, I'm just wondering, like, what would it mean for someone who's used to that external validation or that reinforcement to start with kind of giving that reinforcement to themselves, like kind of reframing that and making that part of their practice is that the validation that I'm used to getting from, my grades or my performance or all of those things. What if I just do the best that I can with what I have, at this time? And what if I put myself in a position where I'm giving myself that reinforcement? Because I think that that not only will help you, kind of move through the journey, but that is something that we should really develop. Anybody should really develop on our own. We have to learn how to give ourselves that, internal validation and reinforcement so that we can do things that speak to us and not only follow a specific formula.
That's a message that I would tell really to anybody, especially if they were looking to go into the any caregiving field, because whenever there's so much emphasis on grades and emphasis on performing on tests, there's so many tests, so many quizzes that they give you a number for how much you know or don't. And it's hard to separate that from yourself. And they show you, oh, this is the curve in the class, this is the average, and then there's you all the way over there. And so you can't help but see that as a value, a personal value.
Mhm.
And talking to especially high schoolers wanting to get into college and like get good grades for college, really trying to emphasize that that is, a quick fix, a quick hit. It's a drug just like any of the others. And the validation comes from actually having something that you're actually passionate about, that you have a purpose doing, that you are excited to do because you know that it will be helpful to someone somewhere, and hopefully you enjoy doing it.
Mhm.
And that can be enough. We don't have to chase these peak experiences where, oh man, I did this and I was the best at that. And I did this and I was also in the top 1% of this. And I did that and it was super great. Everybody loved it. What about doing something and then just enjoying the consistency of doing that thing
Mhm.
and continuing in that process? But it's not flashy. It's not, uh, it doesn't cause potentially a lot of conversation, but it is meaningful. And always having this idea that the work that you're putting out needs the external validation in order to be valuable is a misconception that has slipped me up. I'm sure slips up plenty of people. But it's one that would be do well to leave behind.
I always use this example of like when you reach the top of sometimes people feel unfulfilled or kind of bored or ready to move on because they've already hit the top of their field, right? But it's just from one realm. Like there's so many different places for us to ascend to, right? And we have to give ourselves a chance to do that. And so when you hit the top of one realm and you want to evolve, you're gonna end up at the bottom of the next realm, right? But you've ascended. And so you have to understand, okay, I've ascended, but now I'm back at square one, and give yourself a chance to build and grow and ascend again. And the only way you can do that is by starting from the bottom of the next realm, right? So understand that it's not about always starting over or I've maxed out on my potential. I'm number one. So in order for me to get to number one, right? In my next phase, I have to start at the bottom and build up again. And that comes with learning and experience. And, we can go on for days and days and days, but hopefully, this is spoken to somebody who essentially just needs to get started. All right. So let's move on. So we're going to get a little bit sensitive here. So I want to move into a more personal part of your story because I think it speaks to something much bigger and about the power of our experiences and how we choose them. And I truly am somebody who believes that our experiences are what we need to leverage to really impact other people, right? And so I know that you shared with me privately about an experience, assault, while you were in college. So, please, tell me how much of that experience are you comfortable sharing?
Um, well, I don't mind sharing the experience, and I think the most important parts of it, especially what I learned from that experience, from that trauma, is part of the messaging that I want to bring out into the world
Mm-hmm.
because it ties in with the conversation about wanting to be complete, even understanding the context in which somebody's health is taking place. I'm thinking about the context in which my sexual assault takes place. I'm thinking about the uh, people that are involved, how that impacted me, or how I felt that it meant that I was wrong for so many different ways rather than assigning accountability where it needed to be.
Mm-hmm.
And knowing that this is not an uncommon experience. And so many of my patients experience trauma, sexual abuse, physical abuse, verbal abuse, abandonment, neglect, exploitation. Um, there's only so much that we can do on our own without talking about it. And sharing my experience, empowering others to find some pride at survivorship rather than being wrapped in shame
Mm-hmm.
is another goal of mine with the work that I do, both with my one-on-one appointments and with my students
Mm-hmm.
that that I speak to uh, at large.
Yeah, absolutely. So I would love to, yeah, share whatever you feel comfortable sharing. And then, like you mentioned before, what you learned about the psychological and relational impact of the experience like that, not only for the person, which is you, who experienced the assault, but also, like you mentioned, the people surrounding them.
Right. And so I was at college at Yale. To start with the context, and so there are a lot of very rich people that go to that school, and plenty of people who went to really revered high schools, even private schools, and would have 30 alumni from their high school on campus. But it was just me and my sister. We had a web school reunion, and anytime she and I met up for cake at Claire's or lunch in the dining hall, and I did not have any sort of idea about the hierarchies that exist, the potential uh, predatory nature of the environments that I was in. And I was a fairly sheltered high school student. I didn't go to house parties. I didn't um, have a sense of, I don't know, of deception. I trusted my friends. I trusted my friends generally, and none of them had tried to cross any boundaries with me before. And there wasn't a sense that anybody was more or less valuable in those settings because we all just were from Tennessee. There's nothing. There were some wealthy people and some not as wealthy people, but everybody it was just in the same. They were just the same age, and basically, hey, you're at school together. Make friends.
Mm-hmm.
And so, in that context, at Yale, there, of course, was the imposter syndrome, but then also this desire to be liked, this desire to fit in, that also suppressed dissent, suppressed causing waves or making enemies of anybody. You wouldn't want to make an enemy of somebody who potentially had more friends and more sway than you did because they had more friends at the school and had some of that institutional backing, having rich parents or parents that worked at the school, which was the case with my aggressors. There were two of them, friends of mine, who lived in the same, like just lived a couple doors down from me. I'd spent so much time in their suites in freshman year, didn't see, didn't myself feel targeted. I thought we were all bros, that we were all friends. I didn't see that they saw me in that sort of way. Um, and uh, walking home from a frat party one night, obviously drinking more than anybody, had should have been, and almost certainly uh, on an empty or not very full stomach. Um, but in gonna go to their suite, no big deal. I've been there plenty of times before. Um, but the banter started getting sexual, and what I'm hearing as them actually joking about sexual activity, or them like joking about sexual activity, is them actually planning it. And I didn't necessarily say much, but to just acquiesce, because I wasn't ever taught how to say no to advances. I was just told, no sex, no drugs, no drinking. And that was the education that I had. I didn't know that. And then nobody liked me in school. Should have, all the messaging that I got was just be happy that, a boy's interested in you. Maybe you get a boyfriend now, but one day. Um, and so uh, I left when I felt that they were done with me, and ran back to my room and felt so confused at how something so just normal could have really changed energy so very quickly, because I was just in private. I had felt safe in their suite, but that was I didn't realize how at risk I actually was in that place. And this was a time in college when a lot of the chat stuff was really big, like chat roulettes and Omegle, all of these, really like toxic, terrible chat rooms where like these guys would find people, online to do sexual stuff with, and it wasn't ever anything that I was doing. And but again, I thought I thought there was a separation. I'm like, oh, it's a little bit weird, but that's not what I'm doing. I'm not. Um, I don't know. I wasn't driven sexually like that.
Mhm.
And I think normalized this really dehumanizing way of interacting with people, this really pornographic way of interacting with people. And it can very well blow back onto you. It took me a year to tell anybody about it. And at that point, I did make a report at my school. And it was nice to be able to live in that truth, but it was difficult then dealing with the harassment that followed. And even looking back now, I'm realizing I'm like, wow, this was that they found in my favor in terms of wrongdoing, but um, they didn't really do anything much about the harassment. Although I did mention that, and with this knowledge, even 15 years on, I'm realizing that even the school could have done more to protect me, and before and after the fact. Uh, but I didn't know how to advocate for those things for myself. And it's only with age and only with, you know, 20, 15 years of this evolution of consent education and communication around the toxic nature of exposure to pornography from a young age and lack of guardrails around internet usage that I see the full context of what this was, what sort of environment I was in. Again, not realizing how vulnerable I was and how difficult it was for me to express dissent whenever there's this social hierarchy, um, even professional hierarchy in medicine. It's hard to talk against the senior if you really don't want to cause any problems. You don't want your schedule to be any worse. You don't want to be put on call at the worst times. Like all of your holidays can be gone because you decided to cause a problem. Uh, but I'm glad that I found my voice. I later found about friends who had been through similar experiences and took them about 15 years to even mention it to somebody else, feeling so wrapped up in fear and shame that it wasn't something that they could even utter to try to get past it. And not getting to the point of realizing, hey, I was a victim of a predatory opportunist. This person preyed upon this opportunity, my trusting nature, my seeming ability to or inability to, cause too many problems. Like, oh yeah, she's chill, she'll be no problem. Hey, yuck yuck jokes with jokes. Um, but that was the first time that I asked myself what I actually wanted. So much of my life I've been living in a performance for my parents, for my teachers, for my coaches, for my advisors, whoever. And I didn't stop to think, what do I actually want?
Mm.
And certainly not, I had not had that conversation with myself sexually. And having that experience took me down a journey that ultimately led to me having some empowerment for myself and also some awareness, truthfully, about who has actually earned trust and who is an acquaintance that I who has not earned that trust.
Mhm.
And that I I really feel for that young girl that I was because she wasn't prepared for the environment, the context that she was in. And for my niece and nephews and any child that I do talk to now about consent, I talk to them about the pressures that exist, just around them that you can't see or touch, but they're social pressures, they're interpersonal pressures. There might be conflicting desires. Maybe this is somebody that you do like, which is I like these people. I didn't Part of why I didn't tell anybody is that I didn't want them to get hurt. Right. But they can still hurt you, and being able to reconcile that in your head um, is one of the skills, as being able to assess, hey, is this person actually a friend to me, or do they take more from me than I'm getting from this relationship?
Mm.
I understand that it's not just the social pressures and context that can come into um, not just sexual relationships, but even in the workplace. But it matters that somebody is showing that they respect your boundaries, as somebody that is communicating with you verbally, but also taking the nonverbal kind of closing or stopping as something to inquire about, to take notice of, to sometimes to back away from, to take those cues and not just be so wrapped up in this is what I want, this is what I need, this is my pleasure, is the only one that matters, yada yada. Making sure that people know that they can say no at any point. Not because, oh, this person's already got me in this situation. I've just got to wait till it's over. So many times I've heard that ideology is, oh, they've got me here. And I, I can't leave. I can't leave now. I can't. At any point, you can say, this isn't for me. At any point, you can say, oh, well, I thought we were going to do this, but you've changed now. You want to do this. I don't want to do that. It can be so nuanced. And because the majority of sexual assault that happens with people that it's not somebody getting knocked over the head and dragged down an alleyway. It is people that are close to you and people that unfortunately have taken advantage of that closeness to really get in close so that they can do that work to you. And having that awareness of I'm empowered in this situation. What I want matters. I can leave at any time, and I might be impacted by things outside of even just my own desires. Like I might be coerced or I might feel pressure to do something. But if that pressure exists, then that is not a consensual, enthusiastic, mutually enthusiastic partnership.
Mhm.
And I've taken that philosophy throughout so much of my life. Like I want the things that I'm doing to be a hell yes. And if it's a I don't know or maybe, then it's as good as a no. Because we don't want to be half in or half out when we're trying to have positive relationships with people. We
Mhm.
want to be fully present with others. We want to be able to hold their autonomy and your own autonomy at the same time. So yeah, I definitely fought for a lot of this self-possession and wisdom, but I'm
Mhm.
proud of the fight that I had, and I'm proud that I was able to stand up for myself eventually,
Mhm.
and to learn that skill for the rest of my life.
Mm. Yeah, and I'm proud of you too. I want to first start with I'm incredibly sorry that you had to go through that experience. And I want to thank you for, trusting this space to tell that story, right? Trusting this platform and, and hopefully this conversation can really impact somebody who's gone through something similar. And, one of the things that stood out to me the most and what I hear on repeat is when it comes to different environments, like the importance of being able to use your voice. And something happens to people when you go through experience where it's almost like your voice is taken away or your voice was silenced. And sometimes we don't even realize when it's happening. Like when you said, you know, when there's certain dynamics or hierarchies, whether in the college setting or in the workplace where you unintentionally really make yourself small or don't allow yourself to speak up because of these invisible structures that have been in place. You kind of fall in line and you don't allow yourself to be seen or heard. And so I want to borrow your psychiatry hat and really talk about what is going on with someone, or what is the impact of staying small or not using your voice or being silenced. Who are you as an individual when you're living your life in that space? And then who do you become once you start opening up the space to really start speaking your truth?
And so I would say the biggest risks of self-silencing are actually the not just the mental health risk, but actually the physical health risks. Women in particular have really high rates of autoimmune disorders because there is this relationship between self-silencing, self-erasing, and illness. And that is whether it's stagnant energy or increased inflammatory products, as a byproduct of increased cortisol, or even just increased mental fatigue from always second guessing yourself, not being able to really truly hone your intuitive sense to make decisions, then you don't actually get to know yourself. You are constantly reforming yourself at the behest and at the discretion and interest of others without creating a foundation that actually provides you an opportunity and a venue through which to make yourself, your needs, your priorities, your desires known. And being able to have that be something that people interact with as a means of trying to understand you as a person.
Mm.
There is there's biological need to be understood and to be acknowledged. People are not meant to be solitary beings. They're meant to be around others. But you can feel so lonely and alienated in a room full of people. That's because they don't see you. They don't understand you. They don't seek to know you in a greater way. But you need to be able to have done that work for yourself as well. And when we're not actually in this conversation with ourselves about what we want, what works out best or at least better for us, then we don't actually know how we feel. We don't actually know if what we're doing has purpose for us or purpose for somebody else. There's so much of the greater good that we sacrifice for the greater good, but the personal good ends up suffering. The biggest risk is it actually causes health concerns from you, but there's other risks of shriveling in your relationship with yourself, which one could argue is potentially even an even bigger risk.
Mm.
And this alienation of self from self.
Mhm.
But when we start to move into that space of actually listening to our inner voice, of taking part in that inner dialogue of what do I want? What matters to me? What sort of how do I want to show up as a person in my romantic relationships? How do I want to show up as a person, as a friend? How do I want to show up as an employee or a boss? And that allows us to be in more alignment with not just our path, but with our own subconscious life, with our emotions. We're not, our mood isn't going up and down. We're not impacted by these unknown forces, but we're actually able to live authentically. And then there isn't that conflict or their misalignment between I have to do this thing because I'm living for this other person. It's I am doing this thing because it's aligned with who I am, with the skills and the gifts that I've been given. And it feels it feels better. Which is
Mm,
I say this all the time in my appointments. Ultimately we're just trying to get you to feeling better. You don't feel good? Let's see if we can get you feeling better. But
mhm,
it's such a non-specific thing. I just want to feel better. And it's so subjective as well. I don't know how this
mhm,
person feels. I don't know if they're feeling better. They're just going to tell me. And then the proof is going to be that's the proof that we have. This person feels
mhm,
better. Things work. And sometimes we have some labs that say, oh, yeah, this is showing us
mhm,
that we're on the right track. But if we do have that intrinsic internal feeling that I'm aligned, then our the way that we approach and interact with the greater world around us is more aligned. It's more at ease. There isn't so much questioning or second guessing. It all
mhm,
just fits. It all just actually just fits in line with this conception of self that I've been developing over time.
mhm. Yeah. And sometimes the solution is simple. So it is about, once you're able to exercise that voice and really start to speak to what is true to you, you will feel better. You and everything around you will start to feel more in alignment. And ultimately, you'll feel much better, right? So sometimes the solution is simple. Um, so that's beautiful. Thank you so much for sharing. You're definitely a survivor. I don't know if you like that term, but I definitely can see you really coming into yourself and really leveraging all the different parts of you because it's almost like, this one experience, it does not have to define you or your whole life or be the only thing that you leverage to make an impact in your career. We talked about so many different parts of you, and that's what makes you you, right? And so as you put that collective together, that is the mission that you have, in this space is to leverage all of your experiences and really go out and make an impact into the world. So thank you for sharing not only that story, but all of the different parts of you with us here today. So we're gonna get into a rapid fire closing section, but before you do that, I want to talk about your experience with recalibrated vision. So I know that we worked together on really creating strategic support around you launching your integrative psychiatry practice and as well as your brand. So, how would you describe your experience working with me in recalibrated vision?
I have been so thankful to work with you, Bianca, and have somebody that can really make sense of the swirl that I have going in my head when it comes to business. You're the work that you use is very similar to a psychiatrist's work for on the business side. People come to the visit, maybe they'll have all of these thoughts and feelings and emotions going on, but through the work, finding some with a structure or a framework that helps people find some greater insight so that they can have a direction on how they're going to improve their health with support of other folks on their healthcare team. And
Mm-hmm.
you have given me that structure and that guidance, that framework, so that it doesn't all seem like one chunk of tasks that's just sitting there in a bucket that I have to figure out. There's
Mm-hmm.
a delineation and even being able to talk about some of the hangups that I might have. It's really nice to have your fixed perspective and have your encouragement and validation that you're on the right track. You're doing what is aligned for you. But just like anybody else, there might be roadblocks for whatever reason. And those aren't ones that stay roadblocks. They are just opportunities for greater insight and understanding of self. And
Mm,
also supporting how now that we have this knowledge of self and knowledge of what some potential hangups might be, how can we create a business design that actually is aligned with you, that works in flow, and that is addressing potentially some of the negative thoughts, but then it's also still moving forward with grounding in the positive purpose, positive vision, and honing in on the ultimate root of all of this, which is the sincere desire to expand my educational reach and
mm,
to help people in ways that maybe medicine hasn't always made space for them. But I do want to make that space. And I really appreciate your ability to really synthesize and distill down my journey in
mm.
a nice little trail map of sorts.
Lovely. Yes. Thank you so much for sharing that. And it's an absolute pleasure working with you as well. I mean, you have to have some synergy, right, from the very beginning, and, I completely understood your vision and the direction that you wanted to go in, and I see you as that teacher, and so I'm just grateful that you trusted me, with, this experience and for whatever part, I'm a part of your journey. Thank you so much for trusting me and my guidance, because it's been a pleasure working with you as well, so thank you so much. When you hear the phrase career to calling, what does that mean to you personally?
It says to me that maybe you have a career, but that doesn't necessarily it's somewhat depersonalized. It's not something that suggests that though this might be the case, but doesn't suggest necessarily that this is something that is divinely guided. It's more utilitarian career, like
Mm,
car. Um,
mhm,
but when we're going from career to calling, then it's saying, "Oh, there's something metaphysical about this. There's a certain je ne sais quoi that is physically attracting somebody to this path that I want to call it magic because we don't have an equation to write down and delineate it, but it there's a deeper spiritual basis to finding some sort of employment,
mhm.
but it it is more spiritually grounded and less utilitarian than career. You might
I love that. Yeah. So congratulations from transitioning from career to calling. Love that. All right. So let's go and let's close with a rapid fire round. Okay. So give me one word that describes your journey so far.
mm, diverse.
Diverse. One belief you had to let go of to become the person you are today.
I let go of the belief that being different is a bad thing.
Huge. One belief you didn't have before, but now you hold on to strongly.
It is good to be timely, but everything will come with time and effort. But yeah, just the consistency is more important than making a splash.
Mm, mm. And if you had only one thing, one message to leave behind that encompasses all the work and all the impact that you'd like to make in this lifetime, what would you say? What would that one thing be?
We are all creators creating, and being able to be creative is one of the greatest gifts that we've been given as humans on planet Earth. Creativity creates play, it creates beauty, it creates solutions to problems, and we are meant to create our lives in addition to experiencing it. And so nobody is not creative. Everybody is inherently creative, uh,
Mm-hmm.
but we may not always be told that.
Mm-hmm. Powerful. Well, thank you, Dr. Quao. Thank you so much for joining me and for sharing not only your personal journey, but also the deeper purpose behind the work that you're building. I think your story is such a powerful example of what it means to transform from career to calling, taking your expertise, your experiences, your values, your vision, and turning them into something that can create meaningful impact for others. Dr. Quao, for everyone who wants to continue following your journey, learn more about your practice, or connect with you around your speaking work, where can they find you?
They can find me at harmonyfamilypsych.com. And I also have, I can be reached through my TikTok at Dr. Zola MD, and hopefully more places in the future. Oh, LinkedIn as well under my name, Dr. Zola Quao.
Perfect. All right. And I'll make sure that I put that in the description below. And to everyone watching, if you enjoyed this conversation, make sure you like this episode, subscribe to the Recalibrated Vision podcast, and share it with another healthcare visionary who needs to hear this conversation. Thank you guys so much for tuning in. And please remember to always and forever stay free. I'll see you next time.